No, absolutely not. Antibiotics are destined for specific infections for specific individuals. If you're left with excess antibiotics, you should take it to the local pharmacy and dispose them off. More importantly, if you've got a colleague or a relative who's not well, they may not have the same infection as you. They may have a different infection which may be caused by viruses such as an ear infection or a throat infection, which doesn't need you to use any antibiotics. So in simplistic terms, if, if you are given a course of antibiotics, just complete the course. Anything left, take it to the pharmacy and dispose that off. There are certain infections where the GP would have prescribed you, or the doctor would have prescribed you a course of antibiotics to keep at home, so that if there is an exacerbation or a flare up, you can start them. Conditions like COPD and bronchiectasis. Otherwise, you should complete your entire course of antibiotics. And if there is anything left over, you should take it to the nearest pharmacy. Each and every for disposal. Each and every infection is unique. You should, if you think you've got a bacterial infection, you need to be reviewed by a healthcare professional who would then make a judgment call or an assessment based on your symptoms of whether you need an antibiotic or not. So antimicrobial resistance is when we take antibiotics for a lot of infections, or we take antibiotics or antimicrobials for infections that are not confirmed. The bacteria develop resistance to that particular drug. The more you use a drug, the more likelihood the organism or the bacteria becomes resistant. It's a coping strategy for the bacteria to survive in the environment where there is lots of antibiotic or antimicrobials present. So if you are prescribed a particular medication, you need to ensure that you complete the course. And if you're prescribed repeatedly, you've heard of things like gut bacteria, etc. Those can become resistant very quickly. So it's important that you take antibiotics very much when it is necessary, and if you're prescribed, you complete the course. The simplest way to dispose of unused antibiotics is to take it to your local pharmacy. Do not dispose them in the toilet. Do not dispose them in the bins. It could be picked up by a child and the child could consume, can have a reaction. Do not dispose them into your toilets or flush them down the drain. It will get into the water systems, and we are surrounded by bacteria all over the environment and all over us. And so you end up getting resistance to the bacteria, and the bacteria can acquire resistance.